Hello and welcome. I'm Bob Cusack, Editor-in-Chief of The Hill. Thank you for joining us for our program, Antibiotic Resistance, a Looming Public Health Crisis. Before we begin, I'd like to thank our sponsor, the Pew Charitable Trust, for supporting today's conversations. Whether through overuse of antibiotics, inadequate infection prevention, or natural evolution, bacteria can become impervious to the very drugs meant to kill them. These antibiotic-resistant pathogens, including those that cause some form of pneumonia, tuberculosis, and other illnesses, can result in millions of infections and thousands of deaths per year in the United States. Globally, these resistant infections killed more than 1 million people in 2019, more than HIV or malaria. Some estimates predict that without significant changes, antibiotic-resistant bacteria will kill more than cancer by the year 2050. What threats do antibiotic-resistant superbugs pose for the future? And how has COVID-19 informed our approach for pandemic preparedness? What is being done to develop new antibiotics and bring life-saving drugs to market? And how can policymakers stimulate innovative drug developments to keep pace with evolving diseases? We're going to put these questions and more in front of our fantastic speakers. But first, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag TheHillHealth. We are broadcasting live and will be taking your questions throughout the program. As with any live stream, you could experience occasional trouble with the video. Refreshing the page should, in most cases, fix the problem. My first guest is Senator Michael Bennet from Colorado. He's a member of the Finance and Agriculture Committees and has made antibiotic resistance a legislative priority with his sponsorship of the Pasteur Act, which I'm looking forward to discussing more. Welcome, Senator Bennet.
Thanks, Bob, for having me, and thank you for addressing a topic that I think deserves far more attention than it's been getting, so I deeply appreciate that.
Well, Senator, how did you get involved in this? We have a lot of speakers today have personal stories. Did you hear from constituents? What made you realize, wow, this is something that's not getting enough attention?
As you said, I started to read scientists that were saying that the leading cause of death by 2050 for the world was likely to be antimicrobial resistant infections, and I didn't know what that was, and I didn't, but it caught my attention. For sure. And then I realized that we have a complete market failure in the United States and globally. And as a result, humanity is not developing these important drugs. So I wrote the Pasteur Act and introduced it with Senator Todd Young on this side and Congressman Ferguson, who you're going to have later, as a way of addressing that, fixing the market failure and making sure that we are anticipating what's coming. Unlike COVID, where, it came and we weren't prepared, I'm hoping, not just hoping, we need to be prepared for the next event.
You've said antimicrobial resistance is a looming public health and national security crisis that may one day be our next pandemic if left unaddressed. How has the pandemic changed our thinking along for this issue? What have we learned?
I think it's really changed a lot. What we've learned mostly is that we can't be unprepared. We have to be ready. And in the case of COVID, we were ready in a sense because we had decades of work by pharmaceutical companies on technologies that became the vaccines that we were able to lead the world in. We got to a result very quickly, which is in historical terms, which is a reason why, we know we have to invest on the front end. But I think we were unprepared in other ways. Our public health system was unprepared. We saw the great inequities that exist in our healthcare system. We were unable to protect ourselves or our frontline workers because we didn't produce masks and protective equipment in the United States. This is an opportunity for us to lead the world. And I think one of the reasons why it hasn't caught people's attention in the way that it might is that antibiotics are actually quite effective. We've come to rely on antibiotics as a solution to infection. What we have difficulty imagining is what a world looks like when you have an infection and there is no antibiotic and it's widespread. The economic result of that could be catastrophic for the world, and obviously the impact in terms of human life could be enormous. So I think that an investment of this $11 billion to create effectively a subscription model. So smaller drug companies in particular can know that they're going to be able to stay in business while they work on something that may not be that important to us today, but is going to be very important to us tomorrow, that they're able to survive in a newly formed market.
Senator, as far as the mood on Capitol Hill, we've seen my colleague Reed Wilson wrote a book on Ebola years ago and said it's so important back then to invest millions now so you don't have to spend billions, or with COVID, we've seen trillions now. Do you think that has changed on Capitol Hill, kind of the approach from others who said, well, maybe we shouldn't be spending this much money? They view it more as an investment that can prevent tomorrow's disaster?
I really do. I really do think that's a change in the way people think about things. COVID was a big reason why, and also I would say that after decades of a fiscal policy that really involved cutting taxes for the wealthiest people in the country and fighting two wars that lasted 20 years in the Middle East, I think the American people are demanding, as they should, that the Congress invest in them and invest in our public health infrastructure as well as our actual infrastructure. So I do think that's a sea change. One other point I would make is that, these pathogens are not, we can't fix this problem by ourselves. This is a global catastrophe waiting to happen, but it's a global opportunity for us to lead, I think, in terms of innovation and the coalition around the world that's going to be necessary to make sure that everybody on the planet is benefiting from these new antibiotics. And I know from having spent a lot of time working on this issue that others around the world are looking at the Pasteur Act to plant the flag for them that we're going to take this seriously, and so should they.
On the Pasteur Act, you mentioned you have Senator Young, so it's a bipartisan bill in the Senate. It's a bipartisan bill in the House. Last I checked, it was 20 Republicans and 20 Democrats on board. What are the prospects in this election year? Very difficult to move legislation. Do you think that this could get to the White House?
I was laughing when you were talking about the mood in Congress. But I guess what I would say is we're going to look for every opportunity to pass this. We're going to look for every avenue to pass this. And what you said earlier and what we talked about earlier, I think has been a game changer, which is people realize on the back end of hopefully on the back end of COVID, that we've got to be better prepared the next time. And that's why I think we're going to be able to get this bill passed. And I'm glad it has bipartisan support in both houses. Unfortunately, I can't address the general dysfunction of Congress, but I do think this is one of the bills whose time has really come, and the time is now. And I think we'll find a way to get it passed.
Have you talked to the Biden administration as far as where they are on it, and would obviously be helpful if they came out?
I have. They're supportive, and they've indicated that with line items in their budget, but they can't do this by themselves. They need Congress to pass the legislation.
As far as this issue with the healthcare community and medical providers, what do you think is the most important for them? This is a scary issue, but you don't want to spread fear. What do you think the role of stakeholders at the federal and state level?
It's such an important question. You, at the very beginning of this conversation, you read out or spoke about a litany of things that create antimicrobial resistant diseases. And one of those things is antibiotics not being used properly, not being administered properly, and being abused. That is something that has to change. And our bill says that, we have to make sure that they're prescribed properly. And that would be an important part to diminishing the risk of antimicrobial resistant diseases going forward. The other thing that I just would call to your attention is that I think if we are going to invest $11 billion, we need to do it for real innovation, not just to do follow-on drugs that don't really establish a new threshold for antibiotics. And we call for that as well in the bill. And I think that will be important in the hands of medical professionals who are going to be developing these drugs and making these judgments.
As you mentioned, we're in a global economy. The pandemic originated in China, and then before you knew it, it would spread so quickly to the rest of the world. Internationally, what is the situation? Are there other countries that have done a good job, or maybe even other states that are doing something that we should model something after, so that people get the care they need?
I think actually the Pasteur Act has set the standard. We haven't passed it yet here, but I've talked both to people in the UK that have led very seriously in terms of ringing the alarm that we need to do something. We've had conversations with the G7 as well. But they're all looking to us for leadership, and that's reasonable. I mean, we are the most powerful and most dynamic economy in the world, and we've got an amazing healthcare sector that is developing new therapies all the time, and they really need us to lead. And there is not really an example, except I would say, of public policy urgency, where people in the UK and throughout Europe have really begun raising the alarms.
As far as additional co-sponsors, are you and Senator Young working the Senate floor to get people signed up?
We're working on it. Yeah, we are.
And do you think that obviously it's tough to pass individual legislation, but as you know, Senator, there's always kind of vehicles that are moving, whether it's fund the government. Do you hope that maybe to attach this legislation to something moving?
I think we'd like to find some vehicle as the Help Committee does its reauthorizations, or other opportunities arise for us to deal with long-term healthcare questions. This would be a very appropriate bill to pass as part of that. I think it is, as you said, very unlikely that it would pass by itself, but that also is not impossible. We're going to look for every avenue to get it done. Around here, you just never know. You never know until it happens, and that's why you just have to stay after it. I'm very grateful to have the partnership of Senator Todd Young. He's well respected on both sides of the aisle, and I think that'll help us get it done too.
Well, we'll be watching that legislation very closely. Thanks again to Senator Bennet.
Thanks
for
again.
joining me.
Thanks so much for having me.